says Gaza's biggest hospital is simply becoming a cemetery. Power, medicines, food, water, all running out at Shifa. Let's speak now to Salim Oweis. He is the Middle East and North African spokesperson for Unicef. That's the UN Children's Fund, and he joins us from Amman in Jordan. Thank you so much. You know, I've just been speaking to our Director General in the Department of International Relations, and South Africa is one of many countries condemning what is happening in Gaza, appalled by the loss of civilian life, appalled by what's happening to children. I wonder if you can start by telling me what information you're getting about Shifa, which is the main hospital. It's in the north of Gaza, I understand. And it's contested because Israel is now saying, well, Hamas has tunnels underneath this hospital. They're using the hospital as a human shield. And Hamas is saying, no, we're not. I mean, what's going on at that hospital from a humanitarian point of view, first of all?
Well, thank you. The reality is this hospital has thousands of injured, sick people, including infants in incubators and on ventilators. And the sad reality is these children are now off the ventilators and incubators because of the lack of fuel, because of the cuts in electricity. And this is something that we feared, that we raised the flag on early on. And unfortunately, these fears are becoming true right now. Children are dying in Shifa, but also other hospitals. The problem now is not only one hospital. Yes, this is the biggest hospital, but the problem now is across Gaza. There are over 50% of the hospitals in Gaza are not working, and this number is increasing. And those hospitals that are working and those health workers who do provide services now, they're doing it in the most extreme of circumstances. The situation is nothing short of a catastrophe for children and families in the Gaza Strip, including in these hospitals.
Over the weekend, we heard that Israel said they were going to try and help the civilians. I'm not sure if it's at this hospital or another hospital. Has that actually materialized?
Well, the fact is, the best service we can do these children is to stop the violence and hostilities around the hospitals and attacks on the hospitals themselves. Right now, there's no place that's safe in the Gaza Strip. So even if evacuation was possible, there's no place to evacuate to. That's the fact now for these infants in incubators or on ventilators. We're risking for a few minutes of not receiving the CPR that they need, the ventilator assisted breathing. We're gonna lose more, and that's the problem. So far, we have over 4,600 children killed in the past 5 weeks, and the number is only increasing, and the number is horrifying. To be honest, I'm not sure when this number will become a real flag for the international community to come in and stop the violence and stop the killing of children. We need a ceasefire for humanitarian reasons right now. We need access for the aid, unimpeded and continuous access, and for different kinds of aid, including water, health equipment, medicines, but also fuel. That is the lifeline now for people in Gaza. And we're seeing the impact of the lack of fuel or actually not having fuel at all.
What is the situation in terms of Shifa regarding these counterclaims? Israel saying that it's basically a cover for Hamas headquarters, which is underneath in the tunnels. Hamas saying, no, that's not true. Does UNICEF have a view? Have you been able to establish if that is true? Perhaps, would doctors operating in the hospitals know if Hamas has their headquarters in tunnels underground, for example?
Well, honestly, it's not our mandate to verify these claims, and it's not we don't have the technical capacity to do so. We are not military people, so it's out of our mandate. But what we know is doctors are doing their best. They're the heroes on the ground. Every second of every day for the past 39 days, they're trying to give the best they can to these people. Thousands and thousands of injured and sick people come in, and without that service, with any risk to that what should be a safe place, we're gonna lose more. And I think that's our job, is to keep calling and keep advocating for the safety of hospitals, of schools, of shelters, and of children wherever they are. That's the responsibility of the parties to the conflict, and that's the responsibility of the international community right now.
Do you know if there's any hope of a ceasefire? I mean, there was talk of a 4-hour break in fighting. Are there any discussions underway to perhaps create safe passage for the children? I mean, my understanding is Al-Shifa is just about 500 meters from the sea. One would imagine, that a boat stocked with supplies hopefully could come in. Surely there must be lots of people trying to make plans. And I'm just wondering, I know that there's aid coming from the south over the Rafah border crossing, but that's far south. Are lots of people trying to sort of broker plans? I mean, there must be discussions within Unicef for what can we do for these children?
Of course, as I said, we continue our advocacy and we continue our discussion with all parties, the international community, at all occasions and whenever it's possible, and at all levels. And this is something that we really need. But what we need more, as I said, is the protection of these hospitals and of these children, wherever they are. Any ceasefire is welcome and might elevate some of the suffering, but what we really need is a coordinated mechanism, and any ceasefire should be coordinated with the UN, should be coordinated with the parties of the conflict, and should be of the right, have the right enough time, window of time to allow the aid to reach, to allow whoever needs to be moved away to be moved. All that needs to be part of the discussion right now.
Yeah, absolutely. And I think the critical word is coordination, because you need warring parties to agree. And one wonders what has happened to the time-old tradition of making hospitals almost sacred spaces where you cannot touch them and you allow civilians safety within those walls. Thank you so much. A very, very grim situation, but it's important we keep it on the agenda. That's Salim Oweis. He's the Middle East and North African spokesperson for UNICEF. That's the UN Children's Fund, and he's told us that over 4,000 children have died in Gaza since the bombardment by Israel began.